You've been referred to me for evaluation of some blockage of bile. This can be caused by a number of different conditions. There are several studies we do to evaluate this. Usually do some blood tests of your liver function. Sometimes we do a sonogram or a CT scan to evaluate the structures inside your abdomen. And finally we do an ERCP, which is...
ERCP. The initials stand for endoscopic retrograde cholangiopancreatography. This procedure can help determine where the bile blockage is occurring. It could be at the papilla, in the bile ducts, the pancreas, the gallbladder, or the liver. Bile is a substance that helps the body digest fat. It's produced in the liver and travels through tubes called ducts. Bile is stored in a small pouch called the gallbladder. When bile is needed, it flows through a tube, the common bile duct, that leads into part of the small intestine called the duodenum. The pancreas is another organ that makes juices needed for digestion. These juices flow from the pancreas through a tube called the main pancreatic duct that empties at the same point in the duodenum as the common bile duct. The point where the ducts meet is called the papilla. The bile may be blocked at various points along the way by stones, tumors, scarring, or inflammation. When this happens, bile backs up into the bloodstream, causing jaundice. ERCP can help determine the cause of bile obstruction, as well as show other possible problems involving the bile ducts, the gallbladder, the liver, and the pancreas.
During an ERCP, we use a flexible fiber optic tube called an endoscope, which is passed through your mouth into the stomach and duodenum. Now, during this procedure, you'll be sedated, if not asleep, and will probably experience no discomfort whatsoever.
The endoscope is attached to a powerful light which shines through the endoscope and out at the tip. The tube is very flexible and easily managed by the physician.
Now, this is a safe and simple procedure which can be done either as an outpatient or in the hospital, depending upon how many different studies we have to do along with the ERCP and just in general how your condition is at the time of the ERCP.
Well, what do I have to do to get ready for this procedure?
You must come to the hospital.
Preparing for ERCP is simple and important. Do not take aspirin or drugs that contain aspirin for a few days prior to ERCP. Do not eat or drink anything for at least 6 hours before the test. If the procedure is scheduled for first thing in the morning, do not eat or drink anything after midnight the night before. It's important that you tell your doctor if you're taking blood thinners, aspirin, or aspirin substitutes. You should also inform your doctor of any allergies, especially an allergy to iodine or to any medication for pain. Antibiotics may be given to you before the ERCP is performed. If your doctor has further instructions, you'll be informed of them.
Mrs. Porter, we're about to start this procedure called an ERCP.
Before the procedure begins, you may have your throat sprayed with a local anesthetic. You may be given a sedative medication in a vein of your arm to help you relax. Although you'll be very sleepy because of the sedative, you will be able to respond when the doctor asks you to change positions. You'll have little or no discomfort, perhaps a feeling of fullness at times, as air may be put into your stomach through the endoscope to allow for easier passage of the tube.
Just swallow for me, please. That's right.
The tip of the endoscope is placed in your mouth. It's passed down the esophagus into the stomach and on to your duodenum. As the tube is passed, the doctor examines the lining of the stomach and duodenum. Then a small plastic tube or cannula is advanced through the endoscope and into the papilla, where the common bile duct and pancreatic duct join. Contrast material is injected through the cannula to outline the pancreatic and biliary ducts and allow the doctor to take detailed X-ray pictures. ERCP is a relatively safe procedure and is used routinely to diagnose problems. Many times, the doctor can correct a variety of conditions through the endoscope, eliminating the need for major surgery. For example, if the papillary muscle is scarred or causes pain and spasm, it can be cut. This procedure, enlarging the opening of the papilla, is called an endoscopic sphincterotomy. The endoscope can be used to remove gallstones from the common bile duct, although not from the gallbladder. A gallstone that causes inflammation of the pancreas or pancreatitis can be removed or broken up, preventing further attacks of pancreatitis. An obstruction in the common bile duct can be relieved by the passage of a small plastic tube or stent through the bile duct. An obstructing tumor in the papilla can be opened by a sphincterotomy, or a stent can be inserted through it. A tissue sample can be taken. ERCP is a safe and effective procedure, but there are risks of complications. These risks include pancreatitis, or irritation of the pancreas, from the contrast material used to allow your doctor to see the bile system and pancreatic duct. This could lengthen your hospital stay. Perforation, or a hole in your duodenum, which might require corrective surgery. Bleeding, which could occur if an endoscopic sphincterotomy or procedure to enlarge the opening of the bile duct is performed. Drug reaction from the sedatives given to help you relax. Infection from bacteria already present in your bile ducts. These complications, however, are uncommon and occur in less than 10% of patients having ERCP.
Mrs. Porter, we're all finished now. We're just going to get the x-rays developed.
After ERCP, you will be observed in the recovery area until the major effects of the medication have passed. This period can vary in length, depending upon what procedures were performed. Then you will most likely be able to go home. Or if the doctor feels it's necessary, you'll be admitted to the hospital for observation. If you are an outpatient, you'll need to have someone drive you home from your exam, since the medications given for sedation will not allow you to drive safely. You'll also not be able to operate any machinery or drink alcohol for 24 hours following the ERCP. Because air is pumped through the endoscope to inflate your intestine, you may feel bloated and might have to pass gas after a short time. You might also have a soft bowel movement sometime after ERCP, and your throat may be slightly sore. These conditions are normal. You'll probably be able to resume your normal diet within 4 to 8 hours after ERCP. Your doctor will give you specific guidelines on how soon you can begin taking food and liquids. You should notify your doctor immediately if you experience any of the following after your ERCP. Severe abdominal pain, fever over 100 degrees, black tarry stool or rectal bleeding, recurrent vomiting or vomiting blood, weakness or dizziness.
I'm fine, thank you.
Well, the results are really very, very good. There was nothing serious found.
ERCP is a safe and proven procedure for diagnosing and treating a variety of health problems that once required surgery. With your cooperation, your doctor can use ERCP to work toward a goal that you both share: your good health.